Hello, friends. I'm Greta Nance, and we are going to be having a chat today with Amelia, St. Louis, board-certified plastic surgeon, Dr. Rafi Fredman. We've had him on here many times. He is wonderfully generous with his time to literally step away from patients and leading his team to answer questions for anyone who is interested in plastic surgery, because we all know how frustrating it is to try to get answers out there without having to go into a consultation. So this is something that we're really proud to continue to do and carve out time for. Many of you submitted questions over this week. Here's Dr. Fred.
That we're going to go over, but if you do have questions during this live, you can always drop them below. Hello, good sir.
Hey, how are you?
I am doing great. I was just getting everyone set up for the format here, because I do have a list here for you already.
Great.
But if people think of questions as we're doing this and want to drop them below, I will do my best to try to capture them, but it can be hard to read while you're doing this at the same time. So how are you guys doing over there?
Oh, we're doing great. We're doing great.
Good.
Yeah.
I'm glad. Thank you again for always doing this, and even the time you've been spending in the Bus Mob Facebook community. That's so great for women who are trying to find answers that it's really hard to find.
Yeah, it's my pleasure. I love doing it. Bus Mob's such a great community, and yeah, I have fun answering questions, so
good.
Glad to be here.
Well, maybe next time we should do again like a body part specific,
Sure.
But it is funny. At least 6 of the questions I got today are about kind of lift and implants. So are you okay if we start there?
Yeah, let's do that. That's great.
Okay. So a lot of them, and I get a similar version of this question often. So like, how long basically after breastfeeding until I can have a lift or reduction specifically was this question.
Yeah. So the answer is it depends on each person. There's no specific time because everybody's body is different. Everybody responds to breastfeeding and the changes that happen with and with stopping differently. So the real answer is that you want to go into surgery with things stable. You don't want to have surgery when things are still changing a lot, because then they're going to keep changing afterwards, and they may not change in the direction that we want them to. So if you're somebody that you're at the end of breastfeeding and you're like, there's no change that's going to happen, they are what they are, and then probably it's not so long, maybe 3 months is all that you need. But if you feel like, no, I think there's going to be a lot of change still, I know I want to lift a reduction, but there's probably some change, then it makes sense to wait until that changes happen, whether that's 6 months or even a year, and then have surgery.
Well, that ties right into the next question as well then. What if, okay, I'm 6 months out from breastfeeding, I'm ready for my lift, but I know I want to have more children in the future. Like, I know we talk about that a lot with implants, but this was specifically like, should I just wait in general for a lift until I am 100% sure I am finished with kids?
So it's a little different with breast surgery versus a tummy tuck. Like a tummy tuck, for the most part, you should wait until you're done having kids, because there's gonna be so much change that happens there, and that, it's such an investment, and then to have another surgery. With a lift, a lot of people choose to have a lift before they're done having kids. It again depends on you and how you feel like things have changed over time. The truth is that things may change in a way with another pregnancy that you want to have another surgery revision, whether that's changing, if you have an implant, changing your implant size, or whether it's having another lift. So that's always a possibility. So depends on your priorities. If your goal is to minimize the amount of surgeries you have over your life and just really keep it to one if possible, then yeah, the most predictable way to do that would be to wait till you're done. But if you want this change now for yourself, and you don't want to wait, years to do it, you can do it, and you can have a lift or reduction and still breastfeed afterwards, because you don't cut through the ducts or anything like that. So that's something that sometimes people wonder. So if you're otherwise going to be able to breastfeed, you should be able to breastfeed after a lift or reduction.
Yeah, that is a very common question. Every time people ask me that about should I not, I'm like, that one's a conversation.
Sure.
Yeah,
Exactly.
my sister lost a ton of weight in her early 20s and had a lift and implants at like 22.
Yeah.
She didn't start having kids until 30, and she was still like, it was the best thing I've ever done. And then 5 years after kids, like, had her implants exchanged and had another lift, and was very happy with that, because that was a 15-year span where she dated, got married, you know, lived her life with the breast she wanted instead of waiting for some magical time. So that one's a conversation, ladies.
Yeah, we have a lot of patients in their 20s that get lifts, whether it's on one side because of asymmetry or both sides. So it's really common.
Or even tuberous breasts. Like I always see your great posts. You're very good at that. So, because that usually requires a lift, correct?
It can. It truly depends. The tuberous breast is such a wide spectrum of anatomy, and it doesn't always require a lift. Sometimes implants alone are exactly what's needed to help with things. And sometimes it's only a lift on one side, or sometimes it's a lift on both sides. So it really depends on the specific anatomy.
Good to know. I was researching it this week, actually, because of your great results I saw. How about someone who had implants a year ago and wants a lift over the implants, you know, or a lift now, and also is that even possible? And then she was like, how is that done?
Yeah, absolutely possible. And sometimes that happens because things have changed over time, or sometimes people, maybe they were a candidate for a lift, but they chose not to. And then afterwards they feel like, you know what, I actually do want to lift. So absolutely it can be done. A long time ago, surgeons used to always do these surgeries as separate surgeries. So they can be done separately because the implant is under the breast tissue, whether it's under or over the muscle, it's under the breast tissue. And the lift is really being done to the breast tissue and skin. So they're kind of in two different areas, really. So if you have implants and you think you might need a lift, sometimes something needs to be done with the implant pocket or the implant itself if you want a different size, or the pocket has to be tightened to lift the implant up. But then on top of that, you can do a lift to get the rest of the breast lifted up also.
Got it. So our goal is usually to do them at the same time. So someone has one recovery, less of a cost, and gets their full results immediately. But if something, you know, a lot of people get implants and then lose 40 pounds or have another child and want to lift around it. So it's nice to know that that is possible for sure. A couple augmentation questions. I get this one a lot too. And this was, I think, specifically for you. Hey, why don't you do fat grafting augmentations? You know, do you do it? And I think this person knows you don't do full fat grafting augmentations because in theory it sounds great. And why not?
Yeah. So it's not as much that I don't do it. It's that because a plastic surgeon can do fat grafting to the breast, and there are times where it's actually a great tool. And most plastic surgeons in their, you know, history of doing reconstructive surgery have done a lot of fat grafting to the breast. And that's many of our backgrounds. It just turns out that when you actually talk about somebody's goals and what you're going to get with fat grafting, it kind of is like, that's not that great of an option. And but it's an important thing to talk about. Fat grafting is really good for touch-ups, for enhancing certain areas if there's contour problems, and that's why it's used more in reconstruction. But for just the purposes of breast augmentation, it's just not so practical. You think, well, why not just take 350 cc's of fat and inject it into the breast? And you generally can't do that. You can't put that much fat into one place, or your body will just absorb it. And that actually is what would happen. And if somebody's going to get fat transferred to the breast, they'd have to go into it knowing that it's likely going to be multiple procedures. You're not going to be able to get enough with one surgery. And then there's some other downsides. While it's safe to do, it doesn't increase the chance of breast cancer or anything like that. Fat that's injected into the breast can sometimes look like breast cancer on a mammogram. So it can confuse radiologists, and then they have to get a biopsy. Now you have to go through a biopsy. So
oh my God.
Usually once we talk through those things, people are like, I'll just go with an implant. And that's usually why we end up there.
Yeah. Well, it's like, I wish I had an example of fat right now because I'm sitting here playing with this implant anyway. And I'm like, this is always going to stay nice and round.
Yeah.
Like fat is like Jello, right? It's going to spread around.
Right. So, it doesn't have the shape. Yeah.
Yeah. I can't imagine my previous breasts just making them bigger. I didn't like the shape. You know, my goal was roundness. So this was the way to go for that.
Yeah. And even sometimes people will say, well, I want a really natural look. So that's why I want fat transfer. But you can have a really natural look with implants too. Not everybody wants a lot of upper roundness and things. So no matter what your goals are, it can almost always be achieved with implants. And it's just, I have a lot more control when it's an implant compared to if it's fat.
Got it. Well, let me throw this at you. I did not set you up for this one because I used to hear, I don't hear it as much anymore. Okay, I want that supernatural look. Literally, I want to fool everyone. So I want a teardrop implant, you know, because
Yeah.
the idea, oh, it's sloped, just like I don't have one here. I don't think. Oh, yes, I do. Oh my God. You know, I don't know why I have this. You know, this looks like a natural breast. Why don't we do very many of these?
Yeah. So a few reasons. One is if you hold up that teardrop shape one that you have, and then you take the round one and hold it next to it, like that from the top. So if you straight on, yeah. So see how that also gets a teardrop shape. So so that's when it's sitting on a table, it looks round, but actually in your body, it gets a teardrop shape. So the truth is that you can have that natural look with an implant, and maybe you choose a 106 versus a 107 or just a softer implant. So there's some choices to make there, but the idea was a good idea by the implant companies to say, hey, make one look more teardrop and it'll look more natural, but they've actually proven that to not be true in some research studies, that people couldn't tell the difference either way. So that's usually the reason why we just go with a smooth implant. Shaped implants have to have a texture on it.
Yep,
and,
like this one.
Yep, and there are some issues with certain textured implants and a very, very rare connection to a form of cancer, actually. So usually when we talk through those things, people say, well, I'll just go with a smooth implant for that reason.
Yeah, in theory, it sounds good until you learn a little bit more about it. I've also kind of heard they can flip upside down.
They can. I mean, that's part of
that.
Yeah, that's part of the idea of the texture, is it should prevent that. But it can, and a smooth implant is free to move because it's round, so it's not going to make a difference. But a shaped implant, if it flips upside down, that's not good.
Got it. That was helpful since we were talking about natural. Okay, let's talk about anesthesia really quickly. This question comes up not super often, but hey, I've either had a history of issues with drugs in the past and I want a narcotic-free recovery, and even, hey, I've heard you can do an awake augmentation. Sounds terrifying to me, but I get it. People are like, isn't there an in-between that I could do? Do you do that, and why or why not?
Yeah, so absolutely have patients from time to time that either can't take narcotics for certain reasons. And yes, you can have the surgery and you don't have to take narcotics afterwards. The rapid recovery that we do, a lot of people choose or do this anyways and don't take any narcotic pain medicine. So there certainly is an option for having surgery and you not needing to take narcotics afterwards. That's different than having an awake surgery. So the medications that are used to put somebody to sleep during surgery are not narcotics. There are other medications that are extremely safe. But having a breast augmentation awake is really not a good idea. In order for the surgery to go well, and for me as a surgeon to ensure that somebody has really good results, you have to be comfortable. I need to know that the patient is comfortable and asleep and not possibly moving or things like that in order to make that perfect space for that implant to sit in. I think that if you start accepting trade-offs of, well, we're going to do it awake, then the space isn't going to be exactly where it needs to be, and I think you can affect the end result. So while the idea seems nice, I think that you wouldn't be comfortable. I think you'd be pretty uncomfortable, and I think it actually could have an effect on your final result being not as good as it would be if you would just be asleep.
Thank you for that. That was a good one. Here's a question that, we're opening Pandora's box here. What are your thoughts when a patient asks you about breast implant illness?
Yeah, good question. So breast implant illness, there's a lot to talk about there, but just, briefly, it's the concept that some people, for as long as implants have existed, there are people out there that feel like their implant makes them feel not well, and report different symptoms on it. So there's a lot out there that you can read, and it's a little bit confusing to really understand what is proven, what is, experiences that people have had. So it's certainly a scary area. From my perspective as a plastic surgeon, the approach that I take is that if someone were to come into my office and say, I have implants, I feel like I don't feel well because of that, and I want them taken out, sure, you can always take out an implant. It's permanent, but you can always remove it. And if that's going to help somebody feel better, then that may be a good thing to do. We just don't know enough yet to know if there is even a very, very, very small risk of breast implant illness with implants, there is more research being done there. The research that we have to date shows that they're extremely safe and that there is no proven connection between some of the things that people have attributed to. But that could change over time. So really, my main approach is if there's something I can do to make somebody feel better, then that's something I want to do. And that's a conversation that we would have.
Have you ever taken out anyone's implants who have come in for that complaint?
Yeah, so good question. So I take out implants from time to time for other reasons. Somebody comes in and says, oh, I've had implants for 40 years and I'm done with them. And, you know, we take them out and maybe do a lift or something like that. I don't have patients that have felt like they have developed breast implant illness, so it's not a common thing here to do. So it's just not common in this practice. There may be some practices that it's more common in. But again, if someone wanted their implants out, you can always take their implants out. But an important thing to know in that situation is they'd have to know that there'd be no way to know if their symptoms are going to get better. They'd have to know that they may or they may not, because it's a complicated area.
Yeah, thank you. I wanted to hear someone else say that too. It's not something I have ever seen very often in 19 years. So, but that's a conversation that you should have with your surgeon if you are concerned about it. Okay, I've got a couple tummy tuck and travel type questions. So traveling and surgery, more and more people are traveling. I used to be totally against traveling for surgery. You know, I was like, you do not, you know, want to have to find someone to take care of you in your state. But honestly, I feel differently now. A lot of people can travel very safely. And if they don't have a great plastic surgeon around the corner from them, you should not go to that person. So, but you know, everyone knows about what maybe DVTs are. You know, you always get these warnings on planes, like move your legs if you're going on a really long flight. And from what I understand, surgery can increase that risk slightly. So this person's question was, hey, I want to travel for surgery, but what are the risks when it comes to DVT?
Yeah, so you're correct. Any surgery, there is a little bit of an increased risk of DVT. Now, for the surgeries we're doing, that risk is still really low. The one that comes up the most is a tummy tuck, because a tummy tuck, you're walking a little bit less afterwards. There's more swelling in your legs, things like that. So a little bit of a higher risk, but still a low risk thing to happen after a tummy tuck. Now, in the average person without a specific family history or personal history of getting a blood clot, it's still a really low risk. And the chance of it happening in anyone is uncommon. Now, as far as traveling, it's something that we have to put some thought into, because if you were to have a tummy tuck and then get right on an airplane and sit on an airplane for 8 hours, you may be putting yourself at a higher risk for DVT. So then we have to talk about, okay, what is your travel? How long are you going to be sitting for? Can you get up and move around? So are you driving and you can get out and walk around the car? Or is it a plane that you can get up and walk around? So that's why for different surgeries, we may recommend that you stay in town for a week and then travel back. And I usually tell my patients, if you're going to fly, it's safe to fly after you wait that period of time, depending on what surgery you have, but you got to get up and walk around on the plane. Because as long as you're up and moving around, the chance of a DVT is really low. It's when you're really sitting and not moving that things can pool in your legs.
Got it. So get an aisle seat for sure.
Yep.
So is that what you tell? I know from being in the bus mob community that many women fly to see you. So if they are flying for a tummy tuck or more, say like a Mommy Makeover, do you have them wait 7 days in St. Louis before flying home? Is that your rule then?
That's usually what we do for those bigger surgeries. And some people will decide to stay a little bit longer. Some people want to come in and be seen in person before they go back. Sometimes we're doing that virtually. So that's one of the amazing things with having a patient care coordinator, and ours, Brittany, is incredible with working through that, because each person's travel plans are different. And everyone's very unique and has specific things, and working with her on that is part of the process to make sure that it's really specific for you and is going to go well. Because part of it sometimes is, well, I could go home a little sooner, but I have 5 kids at home, so maybe I'm going to stay a little bit longer, so I have a bit of an easier recovery. So.
It is tough to explain to someone that it's not black and white, because I love to give answers, but that's a common question I get in DMs all the time. But it's like, well, I can only stay 6 days, but I only live 4 hours away. Can I just drive home if I get up every hour and walk? Like, it's a whole conversation, but in general, that is a good idea for somebody who's considering traveling. How about though, just for Breast Aug? Like, how long do I need to stay in town? And if I'm flying into St. Louis, having a breast aug, how many days do I need to stay?
Yeah, if people are flying in for breast aug, they can go home, soon after. I believe usually we say, even the next day they can go back. If they're driving, people will go back later that day or even the next day. Sometimes we have people stay a few hours. Again, depends on exactly how long it is.
Got it.
But breast augmentation, again, I always tell people from here down, you're totally fine. There's no reason you can't get up and walk around and everything.
Yeah. Good to know. Yeah, just you might not want to lift your suitcase up into the overhead bins there.
Sure.
Ask for help for that. Revision assurance. This comes up sometimes and people are like, what is that? I don't understand. Because at Amelia locations, that's an option and it comes up in bus mob a lot. Can you explain when a patient asks about that? What do you say? What is it?
Yeah, so revision assurance, this is something specific to Amelia practices that we have. And the idea is that you have this surgery, you know what cost it's going to be, and it's a scary thought to go into surgery thinking, well, if I have one of these rare complications, let's say I have an infection afterwards and have to go back to the operating room, am I going to have to pay another $7,000 for that? So we came up with a way to help people have peace of mind going into the surgery, and that's what it is, which is because all of our locations have private surgery centers, and we're not relying on hospitals and other facilities for things, we have a lot more control over these situations. So in the very rare instance of something coming up where whether it's an emergency or even a revision down the line where we both look at something afterwards and feel like, yeah, that could be better, it's important for us to be able to have those conversations and money not be on the table. That I can be talking to somebody about, listen, this is what's going on, this is what we have to do, it's going to require a surgery, and not have the overwhelming thought of, yeah, but like how much is this going to cost? That's off the table. So that's why we offer something called revision assurance. There's a small cost to it, but what it gives you for peace of mind, I think is priceless.
Yeah, I don't know whether it was you I've heard say this or somebody else, but it was like, you don't want to cause like an emotional crisis in your life and a financial crisis in your life at the same time. So I love that because it is scary and there is no guarantee. And they're not forever. So I really thank you for answering that. That comes up a lot. I get this one a lot too. How far ahead should I plan this entire process? And I know that differs per surgeon, per office, per surgery you're having, but a lot of people don't even know, is this something I decide to do and I have surgery in 1 month or 1 year? Like, it's very confusing.
Yeah, sure. So thanks for asking that. And you're right. It does depend on the office and even sometimes time of year. I mean, our waiting list fluctuates from time to time. So the first thing I would say is if you're starting to think like, yeah, I want to have surgery in the summer, ask us, reach out to us, because we can tell you like, hey, we're booking into this, or in Raleigh, we're booking out to this. So you should probably go ahead and be thinking about that. But in general, once you feel like you're ready for surgery, you've done your research, you're ready, even if you don't know exactly when you're going to have it, that's the right time to be moving forward. And the neat thing that we do at Amelia Practices is when you schedule your consultation, you also are able to secure your surgery date. So the way that it used to be done in many practices do is you schedule a consultation, then you got to wait another however many months for surgery. So that's hard. So now when you're ready for surgery and you schedule your consult, you also secure your surgery date with our patient care coordinator, and that helps with timeline also. But everyone has their specific things that they have a wedding, and this and timing is going to be a bit different.
Yeah, I am so glad that we do that now. Like,
Me too.
Talk about moms do not have time for a surprise surgery and have to work around it. Like, we are planned out for a year or two. I know the traditional school calendar by heart right now, and we need to plan if we're going to take time off 6 months to a year out. So that is very helpful. Yes, Dr. Fredman works only in our St. Louis location. He is the owner of that practice. So you got to fly there to go to him, and he's worth it. His whole team is. Okay, one more question. I know this is not something we do a ton of, but it's also, again, I get the weight loss question a lot. We know how to answer tummy tuck, breast lift, but a lot of times people have either arm skin, and a lot of people are like, well, what about my leg skin or my inner thighs? Like, what about a thigh lift? So this person specifically, I love this question. It was like, so you can make my skin tighter on my tummy. Can you do that for my legs?
Yeah. Yeah, so that's a great question. And there's a concept that is similar between everything, stomach, arms, legs, which is you could always do liposuction. And liposuction can and often is the right thing to do for arms, the upper arms, or inner thighs. And doing inner or even outer thigh liposuction is a pretty common procedure that people add on to a tummy tuck or mommy makeover. But it has to be for the right person, because what liposuction does or does not do is it does not remove extra skin. So in a tummy tuck, I can do a good amount of liposuction because I know any loose skin afterwards, I'm taking out and pulling everything down. If you're just doing liposuction in the arms or inner thighs, if the person already has more loose skin, sometimes that's not going to be a good idea because you don't want to just create more loose skin. So that's one of those things that during a consultation, I'll look at or with photos before, because it's not that uncommon for me to look at somebody's inner thighs or arms and say, if we're going to do something, we got to take out skin. And if we're taking out skin, then it turns into, for arms, it's called an arm lift, or for thighs, it's called a thigh lift. And the concept is the same for both, which is you do both liposuction and cut out the skin. Now, the trade-off and the hard thing with arms and thighs compared to a tummy tuck is you can't hide that scar the same way you can hide it with a tummy tuck. The tummy tuck gets hidden in the underwear bikini line and you can't see it. With inner thighs, it's a scar that goes up the inner part of the thigh. With arms, it goes along here. And while standing forward, you can't see it. It still is a scar there that really can't be hidden. And for that reason, some people say, I don't really want that trade-off, or not going to do it. And for some people, if it bothers you enough, then you do it, and then they're great surgeries.
And it's a tough recovery, correct?
Yeah, it is. It's a recovery. It kind of depends if you're doing it with other surgeries also. Sometimes people combine it with a tummy tuck or with a mommy makeover.
Got it. Speaking of mommy makeover, did you see that question? That's a good one. This was a tough one for me to answer by messaging people sometimes. So all Amelia locations includes liposuction on the abdomen during a tummy tuck. What does the abdomen include? Yeah,
so I think the best way to understand that is, what is the purpose of liposuction in a tummy tuck? The purpose of liposuction in a tummy tuck is to give you as much waistline definition and as much flatness in your stomach. And the way to give waistline definition is to do liposuction, not just right at your waistline, but you have to go further around the back. So the way I do it, I actually reach around the back, and I use the liposuction candid actually has a curve to it, so I can get really far around the back. Because by starting with that area and then working all the way back up to the waistline and then going across the whole abdomen, that's how you give as much waistline shape and as flat of a stomach as possible.
Got it.
So I do as much of that as I can. The thing that's important to know is there's only so much liposuction that can safely be done during a tummy tuck. There are points when we have to stop, or it potentially causes increased risks. So that's just a good thing to know, is that I'm going to do as much as can safely be done, but anything beyond that wouldn't be safe to do.
Got it. So I think what I heard you saying is, if you need a good bit of liposuction on your love handle area at the same time, that's going to be done. It's all dependent on what you need.
Correct.
But it's kind of the full front area if you need it, and around the sides if you need it.
Correct. Yeah. And most people need some amount of liposuction. It's pretty uncommon that there isn't anything to do liposuction on.
Yeah. Well, I know for a lot of women, multiple pregnancies causes almost this boxiness. So a lot of women ask for that kind of curvature. Yeah.
And that's why I think you have to do liposuction with a tummy tuck, because otherwise I think you do have more of a boxy shape afterwards.
I do feel like I see tummy tucks not necessarily done with liposuction that are a dead giveaway, because the front is very flat, but the sides and back are still very curvy. And I'm like, something doesn't match.
Yeah. And that's why we don't charge extra for liposuction in a tummy tuck, because I wouldn't want to do a tummy tuck without doing all the things that are going to give as great of results as possible. So it's just part of the surgery.
Yeah. Well, thank you so much for doing that. Your pictures are a pleasure to always post on our accounts. And so is all the information that you provide. The reels, I love that one you did the other day on the 107s implants versus the 106. That is such a common question. So if you have not watched that and you are getting implants, go to Dr. Fredman's account and watch that. That was a great explanation. And go follow you for sure. But I will let you get back to your patients and your team. Tell everyone we said hi, and I will see you very soon.
Great. Thank you so much.
Yep. Thanks, everybody. Bye.
Bye. Thank you.